Today, we're tackling a topic that affects millions of men and their families around the world, yet remains shrouded in silence, stigma, and sometimes fear. Imagine waking up one morning feeling just a bit more tired than usual, or noticing a subtle change in your daily routine, something most people might brush off as just a sign of getting older. But what if those little changes were actually your body's way of warning you about something much more serious? Prostate cancer is the second most common cancer among men globally. And while advancements in medicine have made it far more treatable than ever before, early detection remains the most powerful tool we have. The difference between catching it early and discovering it too late could mean everything. Yet, the earliest symptoms are often easy to overlook, dismissed as minor inconveniences or just part of aging. This is why it's absolutely crucial to recognize the subtle warning signs, however mild or ambiguous they may seem. Today, we'll walk you through the 12 early symptoms of prostate cancer that doctors warn us about. Each one explained clearly and simply, with the goal of empowering you to take charge of your health. Whether you're a man concerned about your well-being, a loved one looking out for family, or simply someone who values health education, I urge you to stay with me until the end. Your awareness could change your life, or even save it. Let's begin by understanding why it's so easy to miss the early signs of prostate cancer. The prostate is a small gland, about the size of a walnut, located just below the bladder in men. Its job is to help produce seminal fluid, but when cancer develops here, it often grows so slowly and quietly that symptoms can be mistaken for something else, like a urinary tract infection or just the normal discomforts of aging. That's why we have to be vigilant and listen closely to our bodies. Now, let's dive into the 12 early symptoms of prostate cancer that every man and everyone who cares about men's health should know. Symptom 1. Frequent urination. One of the first red flags doctors often mention is a change in urination habits. If you find yourself needing to urinate more often than usual, especially at night, don't ignore it. This condition, called nocturia, can be caused by an enlarged prostate pressing on the bladder or urethra. Over time, as the tumor grows, it can further block the flow of urine, making the urge to go more frequent and more urgent. It's easy to chalk this up to drinking more fluids or just aging, but persistent changes in your urinary schedule deserve a conversation with your doctor. Symptom 2. Difficulty starting or stopping urination. Another symptom to watch for is trouble getting your urine stream started, or trouble stopping it. You might go to the bathroom, stand there, and find it hard to begin, or you might notice a dribbling effect at the end. This is because the prostate surrounds the urethra, the tube that carries urine out of the body. As the prostate enlarges, whether from cancer or another condition like benign prostatic hyperplasia, it can squeeze the urethra, making it difficult to urinate normally. Symptom 3. Weak or interrupted urine flow. Have you noticed that your urine stream isn't as strong as it used to be, or does it start and stop several times before you're done? These changes can be subtle, developing over weeks or months. Sometimes men put up with these symptoms for years, thinking they're just part of getting older. But a weak or interrupted urine flow is another sign that something may be pressing on your urethra, possibly an early tumor. Symptom 4. Pain or burning sensation. During urination, sometimes prostate cancer irritates the urinary tract or causes inflammation. This can lead to a burning feeling or even pain when you pee. This symptom is often mistaken for a urinary tract infection. And while infections are more common, especially as men age, it's important to get checked out if this discomfort persists. Burning or pain is your body's way of saying, pay attention. Symptom 5. Blood in urine or semen. One of the more alarming symptoms is blood appearing in your urine or semen. Even a small amount of blood should never be ignored. While there are other possible causes, including infections or kidney stones, the presence of blood could indicate that a tumor is growing in or near the prostate, damaging delicate blood vessels. If you ever notice this, call your doctor right away. Symptom 6. Painful ejaculation. Another early sign that often goes unspoken is pain during ejaculation. Men sometimes feel embarrassed to talk about this, but it's vital to bring it up with your healthcare provider. Painful ejaculation can occur if the prostate is inflamed or if a tumor is pressing on the nerves and tissues involved in sexual function. Don't let embarrassment keep you from seeking help. Your health matters. Symptom 7. Erectile dysfunction. While erectile dysfunction, ED, has many possible causes, including stress, diabetes, and heart disease, it can also be an early warning of prostate cancer. If you notice that you're having more trouble achieving or maintaining an erection, and this is new for you, it's worth a closer look. Tumors can affect the nerves and blood vessels that are essential for sexual function, sometimes before any other symptoms appear. Symptom 8. Discomfort or pain in the pelvic area. Sometimes prostate cancer causes a persistent ache or discomfort in the lower pelvic region, between the scrotum and anus, or even in the lower back and hips. This pain may be dull and constant, or it may come and go. It's easy to write this off as muscle strain, especially if you're active or sit for long periods. But unexplained pelvic pain should always be discussed with your doctor, especially if it lingers. Symptom 9. Unexplained weight loss. One of the more subtle but significant symptoms is unexplained weight loss. If you're losing weight without trying, especially more than a few pounds over a short period, it can be a sign that something is wrong. Cancer cells use up a lot of your body's energy, and as they spread, they can cause sudden or steady weight loss. While weight loss can be caused by many things, any unexplained drop in weight warrants a checkup. Symptom 10. Fatigue. Fatigue is a symptom that can be caused by almost anything, from late nights to stress to other medical conditions. But persistent, unrelenting fatigue, feeling tired all the time, even after a good night's sleep, can be an early sign of cancer. As the disease develops, your body may struggle to keep up with the demands placed on it, leading to a constant sense of exhaustion. Symptom 11. Bone pain. As prostate cancer progresses, it has a tendency to spread or metastasize to the bones, particularly the hips, spine, or ribs. Early on, this might feel like a dull ache. Over time, the pain can become more severe or constant. If you're experiencing new, unexplained pain in your bones, especially if it doesn't improve with rest or over-the-counter painkillers, talk to your doctor right away. Symptom 2. Swelling in the legs or feet. Finally, swelling in the legs or feet, known as edema, can occur if prostate cancer spreads to the lymph nodes in the pelvis, blocking normal fluid drainage. This swelling is usually painless, but it can be uncomfortable and is a sign that something isn't right. Don't ignore swelling that doesn't go away. Get it checked out. Now, you might be thinking, most of these symptoms are pretty common. They could be caused by a dozen different, less serious conditions. And you're absolutely right. Urinary problems, pain, fatigue, these can all result from far less dangerous issues. But the key point is this: if you notice any of these symptoms, especially if they're new or getting worse, don't brush them aside. Early detection of prostate cancer is critical. When caught early, prostate cancer is one of the most treatable forms of cancer, with survival rates exceeding 99%. But waiting until symptoms become severe can make treatment more difficult and outcomes less certain. Let's address a reality that many men face. There's a stigma around talking about prostate issues, especially symptoms that affect urination or sexual health. Many men feel embarrassed, or they worry that it's just part of aging and not worth mentioning. This silence is one of the biggest obstacles to early detection and successful treatment. By talking about these warning signs openly, we can help break down that stigma and encourage men everywhere to seek help when they need it. You might also wonder, who is at risk? Prostate cancer can affect any man, but there are certain risk factors that increase your chances. Age is the most significant. Risk goes up after age 50, and most cases are diagnosed in men over 65. Family history matters too. If your father or brother had prostate cancer, your risk is higher. Race also plays a role. African American men are more likely to develop prostate cancer and have a higher risk of dying from it. Finally, diet, lifestyle, and certain genetic factors can also influence your risk. So, what should you do if you notice one or more of these symptoms? The answer is simple. Don't wait. Schedule a checkup with your doctor. They might perform a digital rectal exam, DRE, to feel for abnormalities in the prostate, and a blood test called PSA, prostate-specific antigen, to look for markers of prostate activity. These tests are quick and can provide important clues about your health. But remember, having symptoms doesn't automatically mean you have prostate cancer. Many men experience urinary or sexual problems as they age, and most of the time, these are caused by benign conditions. Still, the only way to know for sure is to get checked. If you're over 50 or over 45 with a family history or other risk factors, talk to your doctor about when to start regular screenings. Early screening can detect changes long before symptoms appear, giving you the best possible chance for successful treatment. If you or a loved one is experiencing any of these symptoms, don't ignore them. Take action, talk to your doctor, and prioritize your health. You're not alone. Millions of men have faced prostate cancer and come out stronger thanks to early detection and treatment. Remember, your health is your greatest asset. Life is too precious to gamble with uncertainty or to let embarrassment stand in the way of care. By recognizing these early symptoms, you're taking a crucial step toward protecting yourself and those you care about. Before we go, I want to leave you with this. The power to change your future is in your hands. Awareness is the first step. Action is the next. Don't wait for symptoms to become severe. Listen to your body, trust your instincts, and seek help when something doesn't feel right. Early detection could save your life or the life of someone you love. Thank you for joining me today and taking the time to invest in your own well-being. If you found this information helpful, or if you know someone who should hear it, please share this with them. Subscribe for more vital health updates, tips, and support. And as always, if you have questions or want to share your story, we're here to listen. Leave a comment below. Take care of yourself, stay informed, and remember, your health matters. See you next time.